Welcome to another episode of Inclusivity in Focus. This is the podcast series brought to you by the Diversity and Inclusion Working Group of the ESCRS. My name is Artemis Matsou and I'm joined by my wonderful co-host, Diana Silva. Hi, Diana.
Hi.
And today we're discussing a crucial topic, which is allies in action, men championing women in ophthalmology. I was really looking forward to this, I have to say, because it's an inspiring conversation to have about how men can actively support women in climbing the leadership ladder, addressing challenges like unconscious and conscious bias, systemic barriers, and societal pressures. And I think we have the perfect guests to explore this with us. So I would like to welcome Professor Burkhard from Germany.
Thank you. I'm not sure if I'm perfect, but I will do my best.
You are indeed. No, you are. And Dr. Joaquin Fernandez from Spain, who are both not only fundamental members of the Diversity and Inclusion Working Group and the ESCRS in general, but also they are passionate advocates for gender equality in our field. So welcome, gentlemen. Thank you for joining us. I'm really excited about this. And I will hand over to Diana to kick off our conversation.
Well, thank you so much for joining us. And I would like to start by asking both of you, Joaquin and Burkhard, since you both come from countries where training in ophthalmology is done differently, and we know that in order to support women in a better way, having equity in the access of education is fundamental. And since, to the best of my knowledge, surgical training is a part of the residency program in Spain, while in Germany it is not. And I have previous experience as a wet lab instructor. I often speak to residents who come to the ESCRS to train. And to get acquainted with basic phaco techniques. And from experience talking to residents from Germany, they all tell me it's so hard to become a surgeon, especially if you are a woman. And obviously, there are a lot of European countries where surgical training comes after residency out of numerous reasons. But I would like to know if you think that focusing on creating a structured surgical educational program, even if post-residency, could be a way of overcoming these difficulties accessing a surgical career.
Joaquin, maybe you start.
Well, we have in Spain, it's called the MIR. It's an exam to assess the residency. It's global for all the territory in Spain. So according to the ranking that you acquire, you select the places. And I really think it's an incredible method. The impulse of the level in ophthalmology, not only in ophthalmology, but other specialty in Spain is based on that, in the democratization of the access to the educational situation. No? In fact, I really think that the general problem that we are going to talk about, diversity, inclusivity, the key is that the possibility of losing talent, not about right, that it's absolutely necessary for the woman war, for all of us, but the key is why to lose talent, so incredible talent, the half of the population. This is the key. And at least in Spain, I really think that we resolve this part of the issue, the educational situation for our women or the equity in this field.
Yeah, and then in the German world, so to say, the world is not so bright. As Diana has pointed out, I think the first step that is mandatory and necessary in this regard is a shift in the mindset of the people. Because if the chair already says it's so hard, then something went wrong here. And so I definitely would advocate that in Germany, where not every assistant learns cataract surgery, for example, that at least what we practice in our department is first offer simulation training, where you can objectively see how good one is. And often females are more talented in terms of hand activities, but also on, let's say, solving intellectual things. And it starts with the mindset again, because what you have to have in mind is that, for example, get rid of the idea that females will definitely also plan during their career, family building, for example. And this can be easily implemented, but often many of my colleagues think, okay, that's the drawback. That's the last thing I want in my hospital, for example. And also that we definitely for the future need better job models, because all my colleagues within the last 2 years I employed were part-time workers. So it's also a question of addressing and also accepting that the younger generation has a different mindset in terms of work-life balance, and you have to promote that. As a chair or as someone in a leader role, I would definitely say, okay, yourself have to serve as a role model and demonstrate inclusive behavior and actively support the female colleagues in various professional settings. And that includes, Diana, of course, education. For example, in my hospital, what I'm looking for always, and I'm securing that the female assistants start with femtocataract surgery. Yeah, and in the past, I think 10 years, we certified 35 female assistants doing femtocataract surgery. So they start now with femtocataract surgery rather than with standard, but they have a good idea and they have good feeling and good manual capabilities. It's a perfect start to then go on an educated level, well-educated level, and also very looking for the details, etc. That is something that we have to look for. And of course, we definitely, as the let's say leaders of our professional development plans, that women have also equal access to these professional development opportunities, let's say it this way. And this includes, of course, not only training, but also conferences, workshops, or training programs, for example. And as Artemis is part of this, for example, also leadership programs like the ESCRS is offering, where you definitely encourage and support female colleagues in pursuing leadership training and positions within our professional organizations, but also in our institutions or networks.
It's great that that you have at least in your department, that you try to make access a little bit more equal, and you promote opportunities for your residents and your assistants. In this case, because in Germany it's post-residency, that you create equal opportunities. I think that is a great way of at least promoting a better, more equal access to surgical education, because I really think that once you make it as accessible for women and men, then it's just like Joaquin was saying. Then you just have exactly the same amount of candidates, and if they're just as good or even better or not as good, it doesn't matter, as long as it's the same opportunity for everyone. And I think that it's great that in your department, even though specifically in Germany, the general scenario isn't as bright, I think it's great that you are working to promote more equity in this sense. And I really think that if we could, in general, in Europe, at least try to standardize a little bit more this process of surgical education or the educational program, it would definitely help a lot of residents, because a lot of residents from countries where this isn't part of the surgical training or even of their residency program, they find it really hard once they are an assistant to climb in the surgical career. And I think that having a more equal system definitely could be a way of making things a little bit more inclusive.
Well, this has two aspects. One aspect is, of course, leaderships. have to change their mindset also. Otherwise, this won't work. And you have to stay ahead of what is going on. And fact is, as you mentioned, that let's say 70% in the assistants, the proportion is female. Fact. Yeah. So if you want to keep the work power alive and the good stuff in your unit, institution, whatever, then you have to adopt down the road. And the earlier you do this, the better. Otherwise, you run into problems in terms of your staff and your employees. Yeah, yeah, this is the second, so to say, part, because otherwise you have no chance. And what I really like is mentorship and sponsorship in this regard, because without this, often they are alone. Yeah, they feel alone at least and are detached. That means it starts with visibility and recognition that, for example, you actively promote achievements, even the smallest one for females, but also for the males. Yeah, and that this comes along with maybe the internal, training and internal presentations and education that comes out of the assistants. And usually it's better by females than male, I tell you. Yeah, that's fact. And but still there needs to be also some kind of mentorship. So what I offer to them and are looking for in the department, that we have also leaders under myself, like head physicians, female head physicians, that play and offer guidance, yeah, and share experience and provide career advice, for example. Otherwise, this cannot work. Yeah, and they navigate down the road their careers and gain confidence and build professional relationships, and that's important, I think. Yeah, and then of course also, which is also a part of this, is crucial, that you support them going to congresses and to other things. That means also financial support if they are just assistants and just residents. Let's say it this way. And offer them opportunities that arise for promotional things, for awards, or other things that are highly visible, because that's important for them, like projects, research projects, and other things that advance their career. Yeah, that's something, advice I would say, what is mandatory too. It's not only opening the door, but also getting into their hands and go with them together to this door, and then they will see what's offering, and then they encourage them and say, okay, great, that's the next step, and advise them. And sometimes it's better that's not the boss in this regard, but the head physicians.
Can I just say, because you mentioned something really important, two important things. One is mentorship, which is extremely crucial, and coming especially from a leader like yourself, but also leaders should be aware of the situation, of the fact that there are biases, there are societal pressures, there are systemic biases in the organizations. And how do you think we can address that in an organization like ESCRS, for example, or a hospital environment? Because it's important that people in senior positions become aware of those things.
Yes.
Do you think something like formal training, which may not be like a one-time event, but something like continuous training on conscious and unconscious biases should be applied, should be employed?
Yeah, the first step, Artemis, this is a great comment. I think the first step is creating inclusive environment. Yeah, because that means inclusive meetings. That means you ensure that meetings and discussions include diverse voices from and you encourage participation from all team members, and you're mindful of who is speaking and who is not. Yeah, and then of course, zero tolerance as the base. Yeah, for discrimination. So you foster a workplace where the culture is that you do not tolerate sexism, harassment, or discrimination, and speak up against inappropriate behavior and support colleagues who do the same. That means the environment must be there. That's not only, that you address implicit bias, for example, by, let's say, an awareness training or something like that, or self-reflection, that you also ask yourself your own biases and how they might influence your behavior and decisions, and strive to mitigate these biases which are there. And then I would say, okay, let's go what Chris Morrill and Moore Dickman does. They make aware of even biases in science, where I would say, how is this possible? What's this fact? It's inherent. And first you have to create the environment is the thing, and then you address the biases and reflect yourself. That is
Perfect.
maybe one approach that, and of course, as the BOSS does now at Barcelona, to advertise a little bit, is that we will have these symposia and presentation, etc., that make you aware that this is an issue. Yeah, because it's often it's neglected, or they are not tolerant to it, and that means we need to talk about these things more.
Absolutely, yeah. And as you say, Barcelona, the program will be very rich in those discussions and conversations.
Yeah.
And Joaquin, is that something that you feel strongly about as well? That there should be more awareness?
Yes, Burkhard tell us a very interesting thing around that. But I really think we need, first of all, the first step would be aware of the community, be aware of the issue, okay? In terms of meritocracy and in terms of loss of talent, for me, this is the key. It's the real key. Think about in the old time in Spain when the educational issue were only based on networking, even in relative relationship. It was natural to be doctor if your father were doctor or somebody in your family were doctor. But in this old time, we're losing a lot of talent. In the same situation, it's quite similar right now. We are losing 50%, more than 50% in relative number based on the school, medical school. We are losing more than 70% of our talent. It's impossible to continue with that attitude. We need to have more talent in our societies, in our hospital. So we need to be aware, all of us, that we have a real problem. It's not about right. That, of course, is very important. It's about that. So we need more educational program, podcast like this, to all the people think about that. We had a real problem, and we have a big problem on that. It's the first step, from my humble opinion. And of course, mentorship, and of course, to reinforce this position. As you said at the beginning, we have conscious and unconscious. That is the biggest problem, unconscious bias. When you don't think about to create a balance, you never think about the balance. So, and we have an incredible person in our society, in the Spanish Society of Cataract Refractive Surgery. We developed some program, and we really tried to find this woman to that situation. And the situation was this balance in favor of the woman. When you think about incredible woman, you find more than you thought. So the key is, first of all, try to disbalance this, to decover this unconscious bias. This is the first step, and you are doing, Artemis, Diana, Chris, of course, Philomena, an incredible work in this field.
No, thank you. That's really nice. I really like the fact that, as you said, that when you try to find more women, you actually find too many women with the right skill set. So that's great to hear. That's really nice to hear.
And then ESCRS comes into play. We offer, as you all know, leadership programs. And Artemis, you are also enthusiastically working in it. And that means we encourage and support female colleagues in pursuing leadership training and positions within our organizations and institutions. And there are plenty of opportunities to engage and participate. And but there's also another thing that needs to be done down the road for us, and that is advocating policy changes. Yeah, that is, I'm talking about institutional policies as well as professional organizations. Yeah, that means institutional, more or less, to advocate policies that promote gender equity, such as transparent promotion criteria, equal pay, by the way, and support for caregivers. Yeah, and then we have the professional organizations like the ESCRS, and that's what we are doing. We work within our organizations to develop and implement policies that support diversity and inclusion in our field. And that's true also for the research committee that's chaired by Joaquin, and but also needs to be implemented in all committees in our working groups.
No, I fully agree. Transparency, I think, is key, because that shows to everyone who's watching actually what is happening within an organization, especially something like ESCRS, big organization, the balance between men and women in leadership positions. That's actually inspiring for other for female surgeons. One thing I have, like, as a personal question as well, because I've come across it in my field, in my profession, is, there is usually a double standard in the perception of assertiveness in men compared to women when they are in the leadership position. So when a man is assertive, then they come across as strong, confident. These are positive traits. But when women are in the same position, they're often labeled as aggressive, or they become unlikable for the same traits, for the exact same traits.
Yeah.
Have you seen that in your institutions where you work? Have you come across that?
Well,
yeah, sure. I mean, Joaquin, please.
No, please.
No, go ahead. Go ahead, please.
No, I really think we need to separate the old world and the new world. The old world were based in power. I absolutely agree with you that all these character of the personality were strong for a world based on power. But right now, the new world asks for leadership, and the leadership asks for soft skill. Soft skill that, for my humble opinion, is better representative in the woman character than in the male character. Overall, I were a male, a man, and young man, and we need to reduce all the apparently power, we discover an incredible skill, and we need to open this new character in the woman world than reproduce this other attitude coming from the past. So from my humble opinion, women are absolutely adequate for this soft skill that we need right now, that could be assertivity, empathy, try to listen for different options, try to create consensus, care for people, customer, an internal customer. All these characters are based in woman world, so don't be afraid about that.
And I think it's a question of education, Artemis, because male, younger people, let's say it this way, are educated. Their main competitors are males, and there it's a sharp competition. Whereas they are not accustomed that a female is now doing the same and is a competitor. And that has something to do with your role model perception. Yeah. And this will change, as Joaquin said. It's a generational problem also, because then males indeed feel under pressure, because usually, the female is eloquent, is kind, is nice, and steps back if someone else is saying, okay, this is this and this way, and there's no objection. And now it's just the opposite. They are outperforming, they're bringing good arguments, etc. That means males then, with their level of education and versatility, feel under pressure and perceive this as aggression, let's say it this way. And that can only be overcome by, again, awareness training and inclusive meetings. And also, what is needed here is a continued, let's say, feedback loop. Yeah. So that you create mechanism for receiving feedbacks, not only from the male, but also from the female colleagues, on how to improve the workplace environment and support the competition and in the way, because all of them want to be good surgeons, all of them want to make great careers, etc. And it's up to you that you also stay informed and keep abreast of the latest research and best practices related to diversity and inclusion in our field, of course.
Yeah, no, absolutely. Thank you. Diana, I think you had a great question about mentorship as well, which was brought up by Burkhard.
Yeah, mentorship, as Burkhard, you mentioned, mentorship is essential. It can be so important, just surrounding yourself with the right people and people that provide you guidance can absolutely shape your career and point your career into the right direction. But I would say that mentors and residency tutors, professors also needs to get education on bias so that they can actually provide a supportive environment. Because I personally have been in situations where I felt my own biases were getting in the way. And I think this is also very important when you are in a position that you are supervising anyone or that you are orienting anyone. I once, with my residents, one of them was pregnant, and I was thinking, oh, maybe I won't ask her if she wants to do this talk because I'm sure that she will not be available. And then I stopped and thought, okay, what am I doing here? I'm not being a supportive person. I need to ask her first instead of assuming, because this is not a behavior that is actually very supportive or at least very neutral. What are your thoughts on this? Because I mean, we are all biased, whether we like it or not. And the more we get educated on this, the more we can actually see it. I mean, before I joined this group formally and before I started thinking about these issues a little bit more into depth, I used to think I'm not a biased person. I mean, I support sustainability, I support women. I'm not a biased person. This is not an issue for me. And then you start thinking about your own beliefs and the way they actually affect the way you may treat people. And sometimes this isn't a very inclusive, friendly treatment. And it's unintentional, but at the same time, it's still relevant because it is affecting the relationship you have with people. So I would like to ask you, what are your thoughts on this? Have you been in similar situations? And should we put a greater emphasis in this educational program into training trainers or people who are actually more in contact or in more leadership and mentorship positions?
So yeah, you bring up an important topic. Train the trainers is good, yeah. But I think that's the second step, Diane, because the first step definitely will be the more basic groundwork, so to say. I have great experience with mentoring students, what I'm right now doing also on a one-by-one basis. And that means you talk about their next steps during their high school work, yeah. And then, of course, I'm also mentoring people on a very high level. They already have a professorship, but they want to make the next career step. So that is a different approach and different topics and different views on it. And yeah, you are right, absolutely right. As I pointed out already, self-reflection is so important, yeah, on the own biases, as you pointed out. And definitely there is an influence on your own behavior and decision. And it's a lifelong learning process, I would say. I cannot say that I'm perfect at all, but I mean, there are things like you mentioned the parental leave, right? Where I would say, okay, you have to support both men also and women, and especially reducing the stigma, yeah, around the taking off time off for family responsibilities, let's say it this way. And that is something that is important for all levels in their career, but because sometimes they just push the time point when they want to become parents even further to 30, 35 or 38, and then it comes into play at a different point in your life. It plays a different role, and that means in general we advocate for equitable parental leave policies, where I would say, okay, this is important.
I really think that when we come from a world with a lot of stereotypes, with a lot of bias and consensus bias, common sense is not good enough. Common sense is not good enough because if we are covered with bias. So we need education, more and more education. I would like you to propose a kind of observatory of inclusivity and diversity, Artemis and Diana, to throw you some practical question in the world life, in the real world life. What could happen if I have this problem and appear in the website of the committee? Because it would be interesting for all of us to see what could be the correct answer to current question of the real world. What happens if, as you said, Diana, if I have a pregnant resident, I have to propose or not? It's elegant or it's gentle not to propose and not to force, or it's exactly the opposite. I need to offer her. So having like an observatory to make a real world question and answer and question to question, let's learn of the community. I really think it would be interesting to all of us.
Yeah, but Joaquin, in Germany, when you are pregnant in a hospital, they directly they take you off. Yeah, there's no chance. Yeah, you're cut off. You cannot do anything. You cannot go into the OR any longer. You cannot do anything. Yeah, you cannot go have patient contact and these things. It's really a mess. And that's in their minds, of course. If you are a chair of a university like me, for example, then of course you have to reflect that you accept that this can happen. Yeah, and not everybody does that. Yeah, I'm not sure what about in Spain. Are you allowed to work still in the OR, etc. once you are pregnant?
No, but it's not as much the idea of centering in pregnancy, but centering in the micromachism that we have inside because we are heritage of the past, of the bias, and only with little question of the real world, a newspaper in Spain create this area of
I see.
question based on micromachism that we are not aware of.
Yeah, no, I like the idea.
Inside.
It's great.
So it probably would be interesting to see question by question and create this culture. Probably could be very fun, or how to say, very educational for all of us to know what could be, because as I told you, the common sense is not good enough to apply in this solution for this question.
It is like we study for anything else, like in medicine. So you get a question or multiple choice questions, which is the correct one. So we should get some training on this topic.
Absolutely.
No, that's great. It's important to, you share your experiences and how you think from your leadership positions when it comes to having like female working with you. I'm sure you have experienced the situation where a female doctor is not usually taken as seriously as a male colleague when it comes to like everyday practice. I mean, I'm sure Diana and myself, we have both experienced that lots of times where it's us and a male colleague in the room and we're automatically considered to be the nurse or the technician or something else, just not the doctor. I think we've experienced it too many times. And I wanted to ask both of you from where you stand, from your leadership positions, how do you deal with that? How do you, when you witness that, do you intervene? Do you interfere? How do you handle it? Joaquin? Whoever, yeah.
So usually what I would say, I would not interfere. I just would say, okay, because it's just a snapshot. But then I would take the female to the side and the 4 eyes and would say, the next time you introduce yourself more consciously and more, clearly, that you say, okay, I'm Dr. Sowieso. I will take care of you here. Rather than be passive and be confident that because otherwise the things will play out exactly as you described. That is a fact. Although you have maybe wide clothes or something like that on, still they will consider you as a second level, so to say, health carer or something like that. Yeah. So the better way is once as a female, then and that is something we need to educate and share more, that especially in the older generation, I would say, yeah, that the perception may be a little bit different because they were socialized in this, and that means that you need to be aware who's in front of you. Yeah, is it a peer like you in the same age? That would not happen. Correct me if I'm wrong. But if you are contacting maybe 80, 90-year-old people, they're completely from a different socialization, and they will think, okay, the female is more the server, and the other one is the boss, and that's the male one. And this, with this mindset grid, yeah, that means then you have to change how you introduce yourself, and that you introduce yourself, for example. And that's the kind of mentorship what I mentioned, yeah, because sometimes you are not recognized this at all on your own, yeah. That was a very, let's say, very aggressive part that I would say, okay, that you as a doctor are considered as a nurse, but these things happen. You're right, but that means again, if you are not recognizing this bias, then you need someone who's mentoring you and makes you aware of this.
Absolutely. And to be fair with you, like I follow your suggestion usually. Well, it took me a while to get there, but when I walk into the room, I introduce myself as I'm so-and-so and I'm your surgeon today. Yeah. Otherwise, I leave the introduction to assumptions from the side of the patient. So yeah, no, that's I'm glad you mentioned that.
Yeah, and especially with your colored hat, I tell you, they will think you are more, for the good stuff and for the well-being rather than the very serious work that will be done.
Even if I hold the scalpel in my hand, I think they would still think that I'm not a surgeon.
Okay, they have an eye problem, Artemis.
But I just mean, the unconscious bias kicks in, and it's just automatically that you're labeled as something else. So as you say, it's good to take over that and prevent that, and then introduce yourself in the right way. I think that's the best advice, actually.
It's absolutely interesting, the thing that the answer of Burkhard, because it's amazing. I was talking about that before, the clinical practice and the clinical question in this area, no? What was the first mistake? Not introduce you and the right of the patient to know exactly who is dealing with. So this is the first right of the patient to know who are you. It's not the problem of the patient identify you or having this bias. So absolutely, I agree with Burkhard that we need, but again, sometimes we need with typical question of the situation of the real world, we need to know exactly what could be the best option, not to blame of. We were very close to blame of this ancient patient that he confused. He poor patient confused because he applied some bias in his head. But the key is we need to, of course, it's very simple. We need to be present, and that's all. So absolutely agree with Burkhard. But again, this micro example coming from the real world is going to teach us too much more than philosophical book compendium about diversity, because sometimes we are all agree in the problem and we are all agree in try to the solution. But the key is put on work, put the ideas very easy to understand. So let's go to that.
Absolutely. And I think we're over time, but we have time for one last question. Chris, do we?
We have how much time we want.
Okay, perfect. Diana, do you want to go ahead?
Yeah, it was very interesting hearing you both about your perspectives on this subject. And I agree with Joaquin when you said that actually having a small book or a small practical guide could be important, since sometimes it's hard to know what to actually say in these types of situations, because we have the perception that this is a problem, but at the same time, we don't know how to act, and we don't also want to hurt anyone's feelings. We just want to make everyone feel equally respected. So I would go ahead with our last question. Our last question was regarding societal pressures. We know that oftentimes women have more societal pressures regarding caregiving activities, societal expectations related to family, and oftentimes they have to juggle their professional responsibilities with these roles. And oftentimes they don't encounter within their workplace environment a supportive environment for actually doing both of these activities. So I would like to know from your perspective what specific policies or initiatives could provide a more healthier work-life balance for everyone, in particular for women, but obviously it's not exclusive to women, obviously. And also, how could men in leadership positions advocate for and model behaviors that could actually challenge traditional gender roles and encourage more equitable distribution of responsibilities, both at work and at home?
Yeah,
So
I think
this is a very this is a hard question.
it
Of
is.
course.
It is.
We want to hear your perspective naturally, because obviously you are within this group, and for us women, at least, this is actually something that is very, very, very relevant while you're trying to build your career, and at the same time you're trying to juggle your family responsibilities, and you want to still advance your career. You still want to be the top surgeon, you want to be at the ESCRS doing things, and all sorts of things, but at the same time you still have family that you have to take care of.
Yeah, so I can start. Promoting work-life balance is more or less what you're saying, and that is includes definitely for me flexible scheduling is a key. As I said already, that in the last 2 years, all my employees have a flexible schedule, and that needs a good program where you organize that some people may leave at 12 or 1 o'clock p.m. and others come in then. Yeah, and that means that we have to go away from this 100% work time that you spend wherever you are. And this also includes half or 1/3 part, for example. We have a lot of people who are exactly working on that basis. And that is the first thing, that you need a flexible scheduling in the work you're offering to your employees. And this is work, yeah, because it needs organization, and especially who's that flexible if this person cannot show up, let's say in the afternoon, yeah. That means sometimes needs to be organized in a very quick way. That also includes maybe that you have flexible workers in your field. And definitely, as what you said in general, first of all, that you support these policies and practices, allowing for flexible work schedules and work-life balance. Yeah, because this is particularly important, what I think, that you retain women in the field. Yeah, because they juggle with multiple responsibilities, as you pointed out. Yeah, that means, for example, that you have in the working place also a care place for the kids, which is mandatory. Yeah, that means that you come as a mother, can bring your kid and then go to work, and someone else, a group, is taking care of the kids, for example. Yeah, there are multiple assets which would last too long. Here, maybe we have a separate meeting on it, as we already pointed out. But these things are the, let's say, soft factors that come into play. Otherwise, we will lose, as Joachim already pointed out, many females in our field, because they have too many responsibilities. And this also comes along with supporting that we need a society that generally goes away from this traditional role model, male and female.
Well, so I really think that we have, absolutely agree with Burkhard, absolutely agree. And I really think in this field, we have a big problem and a big lie. The big problem is that the real problem is inside the family. This balance is not, the problem is not in employees, in work, it's inside the family, at least in the Latino countries. So it's very important to deconstruct all these things and show, be part of the solution in our being example, in our social networking and all these things, and put on fashion to be inside the cook, breeding our child, all these things is putting on fashion for the men would be the key for the succeed. And in the other side, the very big lie is, with this lie, there are not only men, but also women supporting this big lie is inclusivity and diversity is against meritocracy. And this is the big lie. This is not real. We are not talking about don't cover meritocracy with inclusivity. And this is the big lie. We only need to discover all the cover talent, all the cover meritocracy, because this bias. So this is the big lie that we need to fight against, because it's not only the old world, some women right now, some young women even now, they don't want to be aware of this big lie, and they even support this big lie. Inclusivity is against meritocracy. This is the big lie that we need to deconstruct.
And how can we do this, Joaquin?
Because it's not, from my humble opinion, the big issue is not a question of right, of woman right. It's a question of the society, as I said at the beginning, to discover 50% of the talent that we are covering with all this. At the beginning, like when medicine were based on networking with family, relatives, on this thing, we need democratize the option of all the society to medicine. But right now we are having cover 50% of our real talent with all that bias covering with that situation. And it's a big lie that the meritocracy, the inclusivity is against meritocracy. We need to discover all this incredible talent, all these incredible women that we not think on them, because that's real. We are unconscious bias. We don't think about an incredible woman because we always see men and men and men in the congresses. And the first name that we think is these people, not the incredible woman that is working in a hospital, operating incredible surgeries. And we need to create that. But again, this is the biggest lie that we need to fight against.
I really like what you say, actually, because indeed there is this concept that with diversity and inclusion, there is like a push for a non-meritocracy kind of state, but that's not true. As you say, like when you think about more women, a more diverse kind of panel in a conference, in a meeting, you do find those incredible women, as you say, that do all the work. It's just they're not visible enough, and they don't. It's like it's a never-ending kind of problem, because if they're not visible, then they're not going to be invited for a panel, for example. So that goes on and on and on. So I think that's very, very important what you highlight there. And Burkhard, I like the way you work in your department. I can apply for a job there if it's
yeah,
so
immediately
flexible.
I take it. You're employed.
I sent my application through. That sounds very good, actually. No, thank you very much, both. I think we are running out of time. That's your precious time. So thank you so much. That's incredible discussion. I think we learned a lot from both of you, and I'm really glad that we had the two of you in this specific session with talking about how you support women in those roles and in our field. Thank you both, and hopefully we'll see you soon for another podcast, another episode, and see you in Barcelona as well for all those activities that the ESCRS is planning to have.
Thank you. I really enjoyed your company and your comments, and I really like that you are so engaged, and keep on with the good work. And it was a pleasure to participate.
Thank you.
Continue working because it's amazing, all the things that you're doing. Thank you very much.